Here we go again. A quick review of the respiratory pump, the way in which breathing helps to deliver blood through the venous system back towards the right side of the heart. For this, we're going to use an illustration again straight off the graffiti. And in this illustration, what we have here is the torso. Here's the diaphragm, the heart above the diaphragm. Here are the veins coming from the legs. And here's the inferior vena cava going through the abdominal pelvic cavity. All right, consider this. This is all based on Boyle's law. In Boyle's law, it says that when the size of a container gets larger, the pressure of the enclosed fluid, or in this case gas, gets lower. So the bigger the room, the less crowded it is. That makes sense. And inversely, it says that when the volume of the container becomes smaller, the pressure inside becomes greater. That makes sense. Smaller room, more crowded. So in that situation, when a person breathes in, what they do is they contract their diaphragm and it drops down. It makes the chest bigger, but at the same time, it makes the abdomen smaller. Because the chest is bigger, the volume inside the chest is bigger, the pressure inside the chest is less. Now, when we talk about breathing, that's the reason why you inhale, because the pressure in your lungs is now less than the pressure outside in the atmosphere. But we're also going to consider what's happening to the blood, because when the pressure becomes less in the chest and the pressure becomes more inside the abdomen actually squeezes the blood inside the inferior vena cava. That will push the blood up through the inferior vena cava and up to the right atrium. Inside the right atrium, it's a kind of a slam dunk. As soon as the blood gets up inside the right atrium, it drops down inside the ventricle and you got it. It won't fall backwards. Well, at the same time that the pressures are changing right here, the pressures inside your leg are not necessarily changing. And so therefore, if the blood tries to go backwards down into the legs, the valves are there to stop the blood from going from the abdomen down to the legs. So you've sort of blocked their retreat. So the squeeze in the abdomen right here causes the blood to become slightly pressurized, and there's only one way for the blood to go, and that's up and into the right atrium. So you deliver the blood by breathing in. When you breathe out, however, what happens is your chest becomes smaller and the pressure inside your chest becomes greater. This is the reason why the air gets pushed out, because the air pressure inside was greater than the air pressure outside. At the same time, that's happening inside your lungs, again, around your heart. The pressure is increasing. Now, in your abdomen, because the diaphragm came up when you exhale, the volume of your abdomen is now greater. The pressure in your abdomen is now lower. Now blood from your legs can move up into the abdominal cavity here, assuming that there's any kind of pressure down here. So the valves will allow the blood to move up inside the abdomen. Now, it's not at the heart yet, but with the next breath right here, breathing in, you pressurize the abdomen. The blood cannot go back inside the legs, and so therefore the blood can only squirt up through the inferior vena cava and up into the right atrium, slam dunk, and down into the right ventricle, and it is yours. So that is the quick explanation of the respiratory pump using Boyle's law as the foundation.